If you've already tried to treat your shy bladder with a psychologist, psychiatrist, or therapist and it didn't work, this video is for you. I'm Mateus Baziewicz, a clinical hypnotherapist specializing in the treatment of paruresis, a neuroscience specialist, and today I'm going to explain to you why most mental health professionals can't treat shy bladder or paruresis effectively. No, it's not because they're bad, it's not because they don't know what they're doing. The situation is a little different. Simply put, these other professionals are essentially attempting to use the wrong tools for the wrong problem, which in this context is not the most effective approach. By the end of this video, you'll understand exactly what the correct tool is. So stick with me and I'll explain all the details about paruresis. First of all, I want to validate your experience. If you've already been to a psychologist and it didn't work, if you've already taken medication for anxiety and it didn't help, if you've tried cognitive behavioral therapy and still have paruresis, you're not a lost cause, and you're certainly not the only one. Because every day in my clinic, I see patients who have also gone through many different therapies and nothing works. It's not that you're difficult to treat, it's not that you're resistant to treatment. The problem isn't you, so you can rest assured. The problem is the approach. And in this video, I'm going to explain why. Most psychologists and psychiatrists, doctors and urologists treat paruresis as if it were a generalized anxiety disorder or even as if it were a social phobia. And this is completely wrong. It makes sense because paruresis has symptoms of anxiety. You get anxious when you need to use the bathroom near other people, you avoid social situations, you're afraid of being judged. It makes sense, but that's not quite it. It seems like anxiety, it seems like social phobia, but it simply isn't. Objectively speaking, I'll explain to you that paruresis is something much more specific. It's much deeper than that, much more deep-rooted than a simple generalized anxiety or something along those lines. And that's why conventional treatments simply don't work, right? Or if they do work, they only provide a slight improvement over the course of 15 or 20 weeks of treatment. And the first reason why traditional psychologists can't treat paruresis is because conventional psychology, especially CBT, cognitive behavioral therapy, works with the conscious mind and not the subconscious. And I'm going to explain the difference to you. When you go to cognitive behavioral therapy, let's use it as an example. The therapist will teach you to identify negative thoughts, right? And to question those thoughts in order to replace them with more realistic thoughts. So this is working on your conscious mind, it's working on your rational mind. And that's where the big difference comes in, because this works very well for various problems. Cognitive behavioral therapy, it's excellent within psychology. It works for mild depression, for generalized anxiety, in fact, for some types of phobias, including social phobia, but it doesn't work effectively for paruresis, right? And I'll explain why. Just an addendum, when I talk about the subconscious, folks, conscious, subconscious therapy, it has nothing to do with spirituality, right? Paruresis, it's not in your conscious mind, it's in your subconscious. It's a slightly deeper part, of you. When you're in the bathroom and you can't urinate, it's not because you're thinking, I think someone is judging me. It's not because you're rationalizing it, it's because your body triggers an automatic response. Your sympathetic nervous system is activated. Your muscles, the urethral sphincters, they contract involuntarily, and you can't control this, you can't choose this. It's something automatic, something subconscious. Really, for you to be able to treat something that's in your subconscious, you need a therapeutic tool, scientifically proven, but one that accesses this deeper part, that accesses the subconscious. Cognitive behavioral therapy, conventional psychology, it doesn't access the subconscious, it works on the conscious mind, the rational mind, the logical mind. And that's why you can do years of cognitive therapy, understand perfectly that there's nothing wrong with urinating near people, and still you don't see any significant improvement. Reiterating, folks, this doesn't mean that CBT, conventional psychology, is useless, but for this problem, it doesn't work. The problem isn't in your rational understanding, the problem is in the subconscious programming that is active inside you for some reason. And the second reason, why conventional psychology can't actually treat paruresis is because normally these conventional therapies, they treat your symptom and not the cause. And paruresis, it's a symptom, it's not the actual problem. So most professionals, they focus on teaching you how to deal with paruresis, to control anxiety, to face the fear, within CBT with gradual exposure. So there they teach you breathing techniques, they teach you to do gradual exposure, they teach you to challenge small negative thoughts, right? And so these techniques, they are useful, right? They can indeed help you with the anxiety in the moment. but they won't solve the root cause. And that's the big detail, right? Now, in the coming weeks, in the coming months, I'll be announcing, a detailed scientific article about paruresis, where you'll be able to learn more about this. So it's as if you had a plant with a rotten root and you kept cutting off the withered leaves. You can cut as many leaves as you want. As long as that root is rotten, the plant will keep dying, right? And with paruresis, it's basically the same thing, right? The root cause of paruresis is a trauma, more than 90%. It's an event that happened in your childhood, in your adolescence. It's an implicit memory that's recorded in your nervous system. And as long as you don't work on this root cause, you will continue to have paruresis, unfortunately, right? You can learn, 1,000 breathing techniques, whatever. You can do gradual exposure for years, right? Out of 100 patients, maybe one of them will get better. But if you don't reprogram this subconscious code that was installed because of the trauma, the problem will continue. And that's exactly what happens with most patients, who come to me. I've treated hundreds of patients with paruresis. They've already tried, therapy for years. They've tried medication. They've tried gradual exposure. And if you know me, you know that since I also faced paruresis for many years, I've tried all of that too, right? And simply, there's no significant improvement. None of it works because none of these techniques address the root. No one asked what happened. No one worked on the cause of the paruresis, right? And another reason why conventional psychology can't treat paruresis, is because they don't have a specific protocol for it, right? Paruresis is a very specific disorder. Few people in the world know about it, right? Paruresis, shy bladder, has unique characteristics. It has its own dynamic that is very interesting. And most psychologists treat paruresis the same way they treat any other anxiety disorder, right? Whether it's generalized within these submodels, social phobia, social anxiety, shyness. So they use the same protocol they use for social phobia or for the disorder, GAD, generalized anxiety disorder, or for a panic disorder, for example, and that's not going to work. Paruresis is not the same as these other disorders. It has very specific characteristics, which you'll be able to verify in this scientific article that I'm going to publish soon. Paruresis has a very specific cause. It has completely specific triggers. It has very specific subconscious beliefs that make shy bladder and paruresis very different from any other disorder. In order to treat paruresis effectively, you also need a specific protocol. You need to identify the cause, identify the 4 subconscious beliefs that keep paruresis active. You need to reprogram, reframe the original trauma that triggered this in you. You weren't born with it. You need to reprogram the automatic response of your nervous system, right? And that is not done in traditional therapy, unfortunately. This is done within clinical hypnosis, a scientifically proven therapy, with a specific protocol. Also, not just any hypnotherapist will be able to help you with this. It's a professional who understands paruresis profoundly. And unfortunately, I say this with great regret, that very few professionals in Brazil have this knowledge, know about this. And that is also one of my missions, because I am one of the only therapists in Brazil who works exclusively with paruresis in a specific personalized and specialized way in this area. I developed a very specific protocol that treats hundreds of cases of paruresis, and that's why my treatment works very well, both in Brazil and abroad, wherever you may be, whether online or in person. So I'm going to explain to you why clinical hypnosis with a specific protocol for paruresis, how it works, and why we here at the clinic get this result. I would even call it a bizarre result, regarding the significant improvement of paruresis. First of all, I want to reiterate that clinical hypnosis is a tool recognized by the Federal Council of Medicine, the Federal Council of Psychology, and the World Health Organization. Then clinical hypnosis works because it accesses the subconscious. It works directly on the root cause. It reprograms, this code, metaphorically speaking, that was installed. In my treatment protocol, I do the following. First of all, in the initial analysis consultation, I identify the event in your life that created the paruresis, what the original trauma was. Even if you don't consciously remember it today, your subconscious knows exactly what happened. In the second part, I reframe this event with the patient. I help your brain understand that that event is no longer a threat, that you are safe now within the therapy in the correct way. Then we can identify and reprogram these 4 subconscious beliefs that keep paruresis active. Beliefs like being seen urinating is dangerous. I need to be in control. I am vulnerable in intimate situations. right? And 4, we can reprogram the automatic response of your nervous system. So I teach my patients, for your body basically to react differently when you're in the bathroom. And all of this, everyone, happens within 3 to 4 sessions, right? It's strictly fast. It's not years of therapy. It's not months of trial and error. It's 3 to 4 sessions focused specifically on your case. It's not something generic that goes directly to the root cause. And the results are fast. Most of my patients already notice a change from the first session inevitably. My patients usually hear this word, your improvement is inevitable. So if you've already tried traditional therapy and it didn't work, if you've already taken medication and it didn't help, if you're tired of living limited by paruresis, I invite you from anywhere in the world to schedule an initial consultation with me. This initial consultation lasts up to 3.5 hours if necessary. We'll map out your entire history and identify the root cause of your paruresis. And in this consultation, I'll explain all the details of how my protocol works, how clinical hypnosis works, and how your treatment will proceed. My contact information is here in the video description, WhatsApp, email, Instagram. So if you like this video, subscribe to the channel, turn on notifications, and leave a like. I usually post content every week about paruresis, clinical hypnosis, and mental health in general. If you have any other questions about this disorder, leave them in the comments below, and I will answer you personally. All right, everyone? So a big hug, and I'll see you in the next video.